Hi everyone, my name is Katie. I am Cheyenne's mom, and my job is a CVT, which stands for a Certified Vet Tech. So I'm like the nurse to my veterinarian. So I take care of all the intake, getting weights, getting temperatures, making sure their gum colors are good, everything like that. So when you go into a doctor's office and the nurse asks you or your mom and dad all those questions, that's my job, to get all the history before the doctor comes in. We do have a uniform here. It has a black shirt. It's got our logo on it, All Creatures Vet Clinic, which I'm proud to say I helped design. We also have the technicians wear a red shirt with our logo over here. We have black pants. You can also wear gray. And I'm always cold, so I have always a long sleeve t-shirt on under mine, which is also black. So I wear this most of my time. The receptionists up front are allowed to wear black, gray, white, red, kind of solid colors underneath that are dressier. They don't have to wear our scrub uniforms. You have to have covered shoes. They have to be black, white, or gray. And then other than that, jewelry, very minimal, so that way you don't get cut. Earrings, kind of smaller earrings. Hair would like to be pulled back or out of your face as best as possible. So I'm going to give you a tour of the clinic and kind of go through there. And then at the end, I will have pictures of some x-rays, some prepping for surgery, and then just animals that we see throughout the clinic. There were some pictures taken prior to COVID, so I don't have a mask on. Others I do have a mask on, so that is that. Hope you guys enjoy. So this is the front lobby. This is where you walk into when you first get to the clinic. You would go to the front desk, which is at this window right here. Let them know who you have. They would tell you to go sit in this waiting room. There's this scale the technician's going to get the doggy's weight on. So you sit in here until the technician comes and gets you, just like a waiting room. This is the hallway. Then you go down. The dog wing, we have 4 rooms. Some smaller rooms for littler dogs. Medium-sized rooms that we can kind of take anybody in. This is the hallway to go to the pharmacy and back. This is room 3. It's a bigger room. And room 4 is the biggest room. I kind of call it the luxury suite. It's for a lot of the big dogs or multiple dogs. Then going down the hallway to the pharmacy, this is where all the medicine is kept. And this is where we put in all the charges for all the appointments. This is the surgery room. This is where we do all the surgeries. So if a doggy has an owie, we fix them. This is our back room, the doctor's office, surgery. We have kennels there. We have a dental machine, which is right there. An autoclave, which is going to keep things sterile. And this is where we do all of our dentals, on that table. We have all of our supplies. This is our blood workstation and our microscope area, so we can look to see if anybody needs any intestinal parasites. This is our back kennel room, so this is where we keep the bigger dogs in the back. This is our x-ray room. This is where we take x-rays to see if there's broken bones, sprains, if there's masses inside the abdomens, or if they ate something. Those are the gowns we have to wear. This is isolation room, so if we have a very sick patient. This is the doctor's office. This is the cat wing, so we have 2 rooms. I'm going to only show you one. They're both the same thing, just opposite sides. This is our cat treatment area, so we keep our cats back here so they don't get the dog smell. If we have cats that are spending the day with us, they have 2 kennels right there. This is our retail room. We have all of our dog food, toys, treats, collars, leashes, kitty litter, all the supplies to taking care of your pet. And this is Tortuga. She is our resident clinic pet. Her name is originally Denise. We call her Tuga. She is hanging out there. We feed her there, and she gets out to walk around. This is where all of the receptionists hang out and answer phone calls, check people out. We have all those patients, all those files that you see stacked up. Those are all of our clients and our patients that we see. We have a lot. This dog ate rocks. This is another dog that ate rocks. This is a broken bone, and I'll show you a picture of her later. This is Tilly's leg. This dog, if you see the little specks, this dog got shot by a BB gun. This one is hard to see, but it's a pregnant one, has babies. This is a kitty cat with kidney issues. This is a kitty we had to amputate a back leg because it was born backwards. It's just a kitty hanging out on my shoulders. Here's a little hamster. There's 3 puppies in the little purse. There's another very little puppy. I think this one was 24 hours old. There's Tilly with the broken leg. Here's a dog preparing for surgery. We lay him upside down. They're sleeping. This is a little puppy named Dolly that came in for puppy shots. This is Rocky G. This is Dolly. She also had puppies. There they are. She had 8. This is Browning, Banjo, and Boone. Those are Cheyenne's puppies. That's one of her ferrets, Toodles. We also see at the clinic. And that's Minnie. It's just a kitty cat relaxing in our kennels. There's a little rat. We have 2 kitties, Tammy and Duke. This is Pascal, the chameleon that came in. He wasn't feeling so good, but he's very photogenic, takes very pretty pictures. This is another kennel full of puppies for their shots. We had a humane society full of rats come in. I also do some grooming that are medical needs. This dog came in very matted, and he had lots of hair because they didn't get to the groomer very much, so I had to give him a shave. There he is, all shaved up. And there he is again. And one more pictures of Cheyenne puppies. I hope you guys enjoy. Take care.